Okay, so this lecture is going to cover an introduction to what we call joints or articulations. And a joint or an articulation is any point where two bones meet. Whether or not the bones are movable or not, it doesn't matter, because we're going to find out some joints actually don't move. Arthrology is the science of joint structure, function, and dysfunction, and kinesiology is the study of musculoskeletal movement. And there is also a branch of biomechanics that deals with a broad variety of movements and mechanical processes in the body, including the physics of blood circulation, respiration, and hearing. So, joints are classified according to a couple of different things, and that's what we are going to talk about today. So the name is typically derived from the names of the two bones or whatever bones are involved. So there are a couple examples there. You can have an atlanto-occipital joint, you could have a glenohumeral joint, or you could have a radial ulnar joint. And those are all joints that are denoting the bones that are involved within. They are classified according to the manner in which the adjacent bones are bound to each other and the differences in how freely the bones can move. So you have different kinds of joints in your body. So depending on how they are connected and the amount of movement will dictate how they are classified. And there are four major categories. There are bony joints, fibrous, cartilaginous, and synovial. Okay, so a bony joint is an immovable joint formed when the gap between two bones ossify, and they become in effect a single bone. We see this in the frontal and mandibular bones in infants. We see it in the cranial sutures in the elderly. And we see it in the attachment of the first rib and sternum in older people as well. And it can occur in either a fibrous or a cartilaginous joint. Then we have fibrous joints. These are formed at a point at which adjacent bones are bound by collagen fibers that emerge from one bone. They cross the space between them and then penetrate into each other. And there are three kinds: sutures, gomphosis, and syndesmosis. Sutures are immovable or slightly movable fibrous joints that closely bind the bones of the skull to one another. And they can be classified as serrate, lap, or plane. And this has to do with how they are formed. So the serrate has interlocking wavy lines, and we see this type of suture happening between the coronal, the sagittal, the lambdoidal sutures of the skull. Then you can have a lap, or sometimes referred to as a squamous, which is overlapping beveled edges. And we see these between the temporal and the parietal bones of the skull. And then we have the plane or the butt, which is a straight, non-overlapping edge. And we see these between the palatine processes of the maxillae. So basically, it just depends on how these two bones are suturing. The second type of fibrous joint is a gomphosis, and we see these with teeth. This is the attachment of a tooth to its socket, and it is held in place by what's called a fibrous periodontal ligament. The collagen fibers attach the tooth to the jawbone, and it allows the tooth to move a little bit under the stress of chewing. Hopefully not too much. And then the syndesmosis. This is a fibrous joint at which two bones are bound by longer collagenous fibers, and the fibers are longer than we see in a suture or a gomphosis, which then gives this bone a little bit more mobility. We see this in the interosseous membrane, which is between the radia and the ulna, which is what this picture is showing. So it allows for a little bit of movement when you are moving your arm back and forth, whether it's supine or pronate, right? So in that movement, your bones can kind of move, they can kind of slide or you have a little bit of flexibility there. You also see it between the tibia and the fibula, but it is less than in the arm. Then we have cartilaginous joints. Okay, and this is when you have two bones that are linked by cartilage. And there are two types, synchondrosis and symphysis. So the synchondrosis are bones bound by hyaline cartilage. We see this as a temporary joint in the epithelial plate in children when it binds the epiphysis to the diaphysis. And we see this in the first rib attachment to the sternum. There are other costal cartilage, and those are joined to the sternum by synovial joints. So this one, the first rib attachment to the sternum, is what is shown here in the little box in the picture. And then we have what's called a symphysis. And these are when two bones are joined by fibrocartilage. And we see this in the pubic symphysis, which is what is the little bit of cartilage between the right and left pelvic bones. And that is called the interpubic disc. We also see it in the bodies of vertebrae and the intervertebral discs. So there's only slight movement here between the adjacent vertebrae. And it's the collective effect of all these 23 discs that gives our overall spine considerable flexibility. So together, they're all very flexible. You get some flexibility, but one-on-one, it's not that flexible. And then we have what are called synovial joints, or a diarthrosis. And this is a joint in which two bones are separated by a space called a joint cavity. These are the most familiar type, and they are the most free movable. They are also the most structurally complex and most likely to develop painful dysfunction. These are the most important joints for physical and occupational therapists, coaches, nurses, and fitness trainers. And we're going to find out why. Their mobility make them important for the quality of life. So think about where you would have a synovial joint. Which joint could cause you maybe the most amount of pain? I mean, other than a toothache, maybe you didn't even know you had some of these other joints that I just mentioned. But you probably know about some other ones in your body, right? And they are probably synovial. So, general anatomy. There is some articular cartilage involved, and this is a layer of hyaline cartilage that covers the facing surfaces of the two bones. And this, remember, provides for a little bit of movement between those bones. You don't want bone on bone. That's painful. So there's usually a little bit of articular cartilage, and we saw that when we talked about the bones. Then you can have a joint cavity, and this basically separates the articular surfaces. There is synovial fluid, and this is a slippery lubricant inside the joint cavity. It's rich in albumin and hydrolonic acid. This gives basically a slippery texture, similar to an egg white here, it's saying, which not only nourishes the cartilage and removes waste, but it makes that joint able to move without friction. And then there's what's called a joint capsule. And this is connective tissue that encloses the cavity and retains the fluid. There is an outer fibrous capsule, which is continuous with the periosteum of the adjoining bones. And there is an inner cellular synovial membrane, composed mainly of fibroblast-like cells that secrete synovial fluid and macrophages that remove debris from the joint cavity. In a few synovial joints, fibrocartilage grows inward from the joint capsule. You could have what's called an articular disc, which forms a pad between the articulating bones that crosses the entire joint capsule. We see this in the temporomandibular joint, the distal radial ulnar joints, the sternoclavicular, and the acromioclavicular joints. Oh, that's a mouthful. We also have what are called meniscus. These we see in the knee. Now that word might be familiar to you. If you know anyone or yourself has a knee issue, you could have heard of someone having a meniscus tear or something like that. These are in the knee, and this is two cartilages that extend inward from the left and right, but do not entirely cross the joint. These cartilage then absorb shock and pressure, and they guide the bones across one another. And they improve the fit between the bones, and they also stabilize and hopefully reduce the chance of dislocation. There are also some accessory structures that are associated with synovial joints: tendons, ligaments, bursa, and tendon sheaths. So a tendon is a strip or sheet of tough collagenous connective tissue that attaches muscle to the bone. A ligament is a similar tissue that attaches one bone to another. A bursa is a fibrous sac filled with synovial fluid located between adjacent muscles, where tendons passes over bone or between bone and skin. And then we can have a tendon sheath, which is an elongated cylindrical bursae wrapped around a tendon. Okay, so lots going on. We said it was the most complicated type of joint, and I meant it. So exercise warms up your synovial fluid. It then becomes less viscous and more easily absorbed by articular cartilage. The cartilage then swells and provides a more effective cushion against compression. So this is why you should do a warm-up period before vigorous exercise, because literally that's how you tear things. If you're not warmed up, your body isn't warmed up, and it might not be ready to assist you, meaning absorb the shock or stress or bend or move, right? Repetitive compression of non-muscular cartilage during exercise squeezes fluid and metabolic waste out of the cartilage. So that's good. When weight is removed, cartilage absorbs synovial fluid like a sponge, taking in oxygen and nutrients to the chondrocytes. So without exercise, your cartilage actually starts to deteriorate, and it can become inadequate in nutrition and waste removal. So it's good to stay healthy, and it's good to warm up before you decide to do that healthy exercise. And that brings us to the end of our first introduction lecture on types of joints, articulations. Hope you enjoyed.